Can a deviated septum cause snoring? Well, maybe about 10% of the time snoring is caused from a deviated septum. The majority of snoring is caused from the throat and the base of the tongue and the soft palate coming in contact with each other and obstructing your airway during sleep. In rare cases, or about 10% of the time, the snoring is really coming mainly from a deviated septum. And in cases where the snoring is primarily coming from a deviated septum, when we do surgery to correct that deviation, the snoring goes away. But that's very rare. Even if the septum or the deviation in the septum is causing the majority of the snoring, some of it's going to be attributable to the base of the tongue, throat, and palate. So it's unlikely to go away completely, but it may improve with the surgery. Can a deviated septum get worse over time? Well, typically no, but it depends on your age. If you injured your nose when you're very young, then it's possible that you may see a deviation or a deformity of the nose that worsens as you grow, meaning that deformity grows and gets worse as you grow. So many college-age students may say, you know, my nose was a little off and my septum was a little deviated when I was younger, but I noticed as I went through puberty and I continued to grow, that deviation actually got worse as I grew, and it got more extensive. And I noticed more changes in the appearance of my nose, or my breathing got worse, and I had no additional injuries. So if you think about a tree that is planted like a sapling, they kind of tie it up all the way around so that it's staying very straight, so that when it becomes a 20-foot tree, if it's leaning over slightly, that thing's really growing into the side of the building. So it is possible for a deviated septum to get worse over time when you're very young. On the other end of the spectrum, it can get worse when you're very old. So the natural process of the nose is that the ligaments and the cartilage, the attachments that bind them together, loosen up over time, and the nose starts to fall or be affected by gravity. If the septum is already deviated, that fall may be exacerbated or exaggerated by the deviation in the septum that's already there. So what you would get is you'd see a slight deviation. As the patient ages, that nose starts falling more and more to one side. And then in that case, the deviation would worsen with age. So when you're very young or very old, the deviation can get worse or change over time. In the middle of life, you pretty much got what you got. The deviation is not going to change significantly without any additional trauma or surgery. So I recommend if you feel like your deviated septum is changing or it's increasing or causing you more symptoms of obstruction, come in and get an evaluation, and then we can tell you what your treatment options are for that. In the category of self-diagnosis, many people want to know, can I feel a deviated septum inside my nose? It's possible, but it's unlikely that you're going to be really knowledgeable about the anatomy that you feel inside your nose. There's many little grooves, bumps, swellings of cartilage that are actually normal. And believe it or not, the septum has some deflections and changes in size as you go from the floor of the nose to the top and from the tip of the nose to the back. The septum isn't exactly like a business card. It has some undulations and changes in shape. They're actually completely normal. So it's unlikely that you're going to be able to make the diagnosis or feel and confidently be able to assess whether you have a deviated septum or not. If you're that curious, I recommend you coming into the office, getting an evaluation, and then we can let you know what your options are, or if you even have a deviated septum to begin with. Can I give myself a deviated septum? Well, it depends on what you mean by give. So if you're a boxer or you play any contact sport or you kind of roughhouse or you live an aggressive lifestyle, then yeah, it's possible for you to end up with a deviated septum, and the number one cause of that is going to be some form of trauma. Typically, you're unlikely to give yourself a deviated septum by just blowing the nose, or looking up your nostrils, or just kind of manipulating your nose using a Biore or having a facial. Those types of things are not going to give you a deviated septum. The septum is made to move, twist, and turn with your everyday life. It's very pliable, it's springy, and it'd be very difficult for you without a traumatic event to cause a deviated septum. If you're curious and you think you may have one, I recommend you coming in and getting an evaluation, and we can let you know if you have a deviated septum or not and what your treatment options are. Deviated septum and headaches. Is that a possible cause of headaches, having deviated septum? It could be. Sometimes the septum is so severely deviated that the patient is almost completely 100% obstructed on one side of their nose, which leads to drainage problems with their sinuses and can lead to a sensation of fullness or congestion, which can lead to sinus headaches, and frequently the main cause of that may be a deviated septum. If you have a septoplasty and you correct that, many times that headache or that sinus pressure will improve even without a sinus surgery, because now the sinuses can drain properly and it relieves many of the symptoms. The only way to know is to come in for an evaluation, perhaps have a CT scan to make sure that there's no primary sinus disease, and then we can give you your options for treatment and trying to relieve your symptoms. Deviated septum surgery. What's that all about? Well, a lot of people feel that a septoplasty, which is a surgery for a deviated septum, is really a rhinoplasty, and they're very concerned about having puffy eyes, bruising, a broken nose, a cast, and being really congested for weeks and weeks on end. The reality is that a true septoplasty does not involve breaking any bones. It doesn't involve having black and blue eyes. You don't have to wear a cast on your nose, and the recovery is relatively quick. The surgery is performed as an outpatient. It's under general anesthesia, so you're completely comfortable, and the majority of the surgery, if not all of it, is done through the nostrils with no incisions whatsoever. It involves repositioning the cartilage to the middle of the nose so that the air passages are clear on both sides. After the surgery, you'll convalesce and recover at home. We'll see you in about 5 days after the procedure, and then do an evaluation to make sure everything's healing okay, and then you can get back to your normal life. It's very important to note that a septoplasty is not a rhinoplasty. That recovery takes a couple more days. It may involve repositioning the nasal skeleton or the nasal bones, and you will have a cast on after that procedure. So, in other words, a septoplasty is pretty straightforward. A septorhinoplasty or rhinoplasty is a little more involved, but I think for a straight septoplasty, there's nothing to be concerned with about having black eyes or people thinking you may have had a rhinoplasty, which is a concern for many patients. The recovery is pretty quick, and it's not a relatively uncomfortable procedure. To learn more about the treatment and what you're a candidate for, I recommend you coming in for consultation, and we can let you know what all your options are. Deviated septum surgery recovery. So what's the recovery time after I have a septoplasty? How long will I be out of commission? Well, septoplasty surgery is done as an outpatient, so that gives you an indication that the recovery is going to be pretty quick. The typical amount of time for recovering after a septal surgery is going to be about 5 to 7 days. After that period of time, you probably can go back to work, but we recommend you don't do any strenuous exercise or heavy lifting for approximately 2 weeks. After that period of time, you can slowly get back to your normal routine and start feeling like you're breathing better and you're back on track to living a normal life again. Does septoplasty change the shape of the nose? Well, some of the terminology can be confusing for the patient. Sometimes we use the term septorhinoplasty where we would be manipulating the septum, and it would also change the appearance of the nose, either by really straightening out a crooked nose that's deviated not just on the inside, but on the outside as well. And that would be more of a septal rhinoplasty. A straight septoplasty addresses deviations internally that we cannot see on the outside of the nose and help the patient to breathe better by centering the cartilage in the middle of the nasal passages so that the airflow is even on both sides. So a septal rhinoplasty may be something that straightens the septum and improves the appearance of the nose. And a straight septoplasty may be internal work on a deviated septum that improves the breathing only. To know what you're a candidate for, I recommend you coming in for a consultation, and we can give you your options and see what you're a candidate for in the office. How's a deviated septum diagnosed? Well, you can do a little home diagnosis by looking at the nose in the mirror and seeing if you see the tip of the nose kind of tilting to one side or the other. Outside of that, you can look up at the base of the nose and see if the columella, which is the center skin or divider between the nostrils, is kind of bent, twisted, or turned to one side more than the other. In those cases, you may have a deviated septum. If there's an internal deviation, you may be aware of it because you either feel obstruction on one side of your nose only, or you may have had a recent trauma where you were breathing completely fine and now you can't breathe out on one side of your nose. Any of these scenarios may be consistent with a diagnosis of a deviated septum. To confirm that, when you're in the office, we'll do a nasal exam with a speculum and possibly a nasal endoscopy to confirm the diagnosis of a deviated septum or any other co-diagnoses that are present at the same time, and then give you your options for treatment going forward. How long is the recovery from a deviated septum surgery, otherwise known as a septoplasty? Well, if you're having a straightforward septoplasty procedure that's not combined with a rhinoplasty or a sinus surgery, the recovery is usually about 1 week. You'll feel congested in the postoperative period. You may be a little sore, but after about a week, you can get back to your normal activities, such as going to work and getting back to the beginnings of your exercise routine and feeling like you're on the road to recovery. Is there a deviated septum self-test? Like, can I diagnose myself? Sometimes. Sometimes it's obvious. Maybe a patient had a nasal fracture and they can tell their nose is kind of twisted or bent or leaning to one side. That patient may see an external deformity, but it's highly likely they have a deviated septum as well. Another way to make the diagnosis is to tilt your head backwards and look in the mirror, and sometimes you can see the columella, which is the center divider on the outside of the nostrils, in between, in the center, is kind of pushed or tilted or bent from one side to the other. Those patients may also have a diagnosis of a deviated septum. If there's an internal deviation that's kind of further back in the nose, it may be difficult for you to make that diagnosis on your own. And you may feel symptoms of nasal obstruction and be unsure of whether you have a deviated septum or just congestion from sinus disease or allergies. I recommend you coming into the office to get an evaluation because we can determine what is the exact cause of your nasal obstruction and let you know if a septoplasty is in the cards for you or if there's medical management that can help you breathe better. So, is there a deviated septum treatment without surgery? Well, unfortunately, the answer to that question is no. But it doesn't mean that you can't have some relief of your nasal obstruction with medications. Many times patients have a deviated septum and they also may have chronic sinus disease or enlarged turbinates that are also contributing to the obstruction inside their nose. If those issues are addressed, even though the septum may be slightly deviated, the patient may have significant symptom relief and be able to avoid having a septoplasty. The only way to know what you're a candidate for is to come into the office and have an evaluation, and we can discuss your options for treatment of any chronic sinus disease, turbinate enlargement caused from allergic rhinitis, and evaluation of your deviated septum, and present you with the best treatment plan for you. What are the most common causes of a deviated septum? Well, believe it or not, most septums are deviated during childbirth. So the nose you're born with is the nose you have for the rest of your life. Any deviations in the septum caused by any bumps or injuries to the nose during childbirth can cause a deviation that you keep your whole life. You don't have to have any injury beyond that. Second most common cause of a deviated septum is going to be some form of trauma. It could be contact sports, such as boxing, kickboxing, wrestling, basketball, football, anywhere where you could potentially injure or break your nose. And that's going to be the second most common cause of deviated septum. And then, like we mentioned in an earlier question, age. As you age, the nose can tend to be affected by gravity, and any deviation that you may or may not have can be exacerbated just by the nose changing shape from your age. So those are probably the most common causes of deviated septum. There's some obscure things like a septal perforation, which can cause a septum to deviate because it's missing some of its support and it starts to collapse. If you think you're having a deviated septum or you're having symptoms of nasal obstruction, or you're worried that you may have a perforated septum or a hole inside your septum, I recommend you come in and get an evaluation, and we can let you know what your treatment options are. So what is a deviated septum? A deviated septum is a bend, twist, curve in the center partition and cartilage that makes up the inside of the nose and divides the nasal cavities into two halves. If you feel the base of your nose and you kind of wiggle it back and forth, you can feel something clicking. That's the septum. And a deviated septum means that it's twisted or bent or tilted to one side or the other. Sometimes, in rare cases, the septum is S-shaped and it obstructs both sides of the nose. The surgery to address that is called septoplasty. To see if you're a candidate, I recommend you coming into the office and getting an evaluation to see what your options are to improve your nasal breathing. What is septoplasty? Septoplasty is an operation that addresses a deviated septum, which is the center divider inside the nose. Many times, either from a traumatic injury or sometimes just from birth, patients will have a bend in the cartilage that divides the nose or the septum, and that's called a deviated septum. A septoplasty addresses this by repositioning the cartilage to the middle of the nose or excising septal spurs or damage to the cartilage so that the patient has a clear air passage on both sides of the nose. What treatments are there available for me if I feel I have a deviated septum? Well, typically we'll start with an exam to see if there are any other conditions affecting your nose, such as turbinate hypertrophy, congestion from allergies, or any chronic sinus disease, nasal polyps, or enlarged adenoids and tonsils. Those things can contribute to nasal obstruction as well. If none of those things are present, then you probably are having nasal obstruction caused by the deviation in your nasal septum, and we'd offer you surgery as a correction of that symptom. To find out for sure, you have to come in for an evaluation, and we'll let you know what your exam findings are and what treatment options are available to you going forward.